mama! As your due date draws nearer, it can be quite tricky to determine whether you are really experiencing the start of labor or just going through the warm-up phase, what we call pre-labor or sometimes false labor. So in this video, I will address the question that crosses probably your mind too. How will you be able to tell when you are truly in labor, and what are the signs of pre-labor, false labor contractions? I am Kate Rux, a doula, a Lama's childbirth educator, and a mother of two fantastic girls. I help you to make truly informed, conscious decisions about birth with my easy-to-understand, evidence-based online childbirth education program. And then on my website, which is the www.ownyourbirth.com, there you can find various course bundles which empower you to shape your birth journey, your breastfeeding journey, your postpartum journey, according to your values and your preferences. I also offer on my website a free childbirth workshop, so please just subscribe there for super practical, really easy to implement birth tips which can help you to make your birth smoother and more enjoyable. Okay, but let us now go back to our topic. So labor and pre-labor. So pre-labor is the term for the early irregular contractions, and this is sometimes also called forced labor. And I personally do not like this second expression, because there is nothing false with it. There is nothing false with those contractions, and there is nothing wrong, nothing false in what your body is doing. Because your body is actually just doing what it has to do. It is preparing, a kind of warming up for the real job, for the birth of your baby. And those very early contractions before the onset of labor, they play a very important role in the birth process because they prepare the cervix for the dilation when the right time comes, allowing your uterus to release your little bundle of joy. When you are approaching your due date, during the checkups with your care provider, the focus is mostly on the opening of the cervix. Is it already open? How many centimeters have you dilated? Or maybe how many fingers wide is the dilation? However, there are many other important changes that occur in your body before the opening of the cervix. And those changes, they are really essential for bringing your baby into the world, and that is where pre-labor plays a very important role too. So let us now see a little bit the cervix before we dive into the differences between pre-labor and true labor. So when your body is not preparing for labor, either because you are not pregnant or because labor is still far away, then the cervix is a few centimeters long, a kind of cone-shaped muscular structure that is a continuation of the uterus. It is hard, it is almost as hard as a bone, as your forehead, for example. And normally the cervix points towards your backside. But as your body prepares for labor, the cervix needs to turn towards your front to be aligned with the birth canal. So the cervix needs to change its position, and it also needs to get softer before dilation begins. And during this process, from something as hard as is your forehead, the cervix becomes first something like your nose, and then eventually as soft as your lips. But achieving this forward movement and this softening, that takes time and pre-labor contractions. But not only do these changes happen to the cervix, but it also undergoes a complete transformation, so its shape changes. Because this 2-3 centimeter high cone is gradually flattens to become actually paper thin, and at the end of this process the cervix really retracts and basically disappears into the uterus, and it's an amazing transformation that occurs within just a few days or sometimes even just within a few hours. But regarding the pre-labor contractions, The key point to note is that they generally do not cause the cervix to open yet. So they do not dilate the cervix, but they rather facilitate those cervical changes which we have just mentioned. So they are softening the cervix, they are moving it forward, and they are thinning it, they are effacing it. And what sets them apart from real labor contractions, which are already dilating the cervix? So how can you know if you are still in pre-labor stage or already really truly in labor? Well, the big difference between the two is that pre-labor contractions do not progress over time. They may come irregularly, sometimes 5 minutes in between, sometimes 2, sometimes 10, or even if they are kind of regular, their rhythm and their intensity and their duration do not really evolve for hours or sometimes even for days. But please do not worry at all. Also, if you do not have any pre-labor contractions, if you do not experience this kind of foreplay of birth, and if your body really starts immediately with real labor contractions, that is also perfectly normal. But let us now see the real labor contractions. So when we talk about true labor, about contractions which are already opening the cervix, then the contractions do progress and they do evolve over time. They become more frequent, they become longer, and they become stronger over time. And if at least 2 out of these 3 conditions are applying, then you are definitely in real labor, and your cervix is very likely already dilating. In most of the cases, all of those 3 conditions apply, so contractions are becoming closer together, longer and stronger. But again, if already, for example, just their frequency and their strength increases, but their length remains the same, that is already a definite sign of labor. Or if they are still not getting closer, but you feel them becoming stronger and longer, that is also a clear indication of real labor. It is also quite common for those irregular or non-progressive early labor contractions to eventually transition into true labor after a while, but sometimes this pre-labor stage lasts a day or even days. On the flip side, it is also entirely normal for these pre-labor contractions to stop after a while and then resume the following day or even a couple of days later. So this period can be so diverse and it can last for quite a long time, and I know that it can be nerve-wracking for both you and your partner. So this is why it is really essential to prepare for this and to face this period calmly. And the best strategy I suggest is to simply to ignore these irregular contractions. So try not to focus too much on them, try not to time them, but just go with the flow and try to continue your normal daily activity according to the time of the day as much as you can and as long as you can. But an important remark: if you have had already a membrane sweeping, then you may also expect a quite long pre-labor phase before the onset of regular contractions. So this is a quite common impact of the membrane sweeping. One vital point is that after 37 weeks, if you do not have any health issues, if you do not have any pregnancy-related risks, you do not need to worry. You do not need to rush to the hospital or call your provider because of these pre-labor contractions. Not even if you notice a few drops of bleeding or some pinkish discharge or a kind of mucus, because these are entirely normal signs of pre-labor. And there can be a few drops of blood because as your cervix changes, then tiny blood vessels, they may burst in your cervix, and that is why the mucus may become streaked with fresh blood. So this is also a very definite sign that the big moment, the onset of labor, is now really getting closer. But the pre-labor period can be nerve-wracking and can really test your patience. If it is long, but try to accept this phenomenon calmly and patiently, and just trust your body, that your body really knows what it is doing and what its task is ahead. So think on the pre-labor period as an important preparation for your body for the birth of your little baby. And if you want to know more, not just about pre-labor and real labor, but really face your birth empowered and equipped with reliable information, with tools to help you to cope with birth, then just visit my website, which is the www.ownyourbirth.com, and choose from the online childbirth class bundles. And also, if you have not done this yet, then just subscribe to my free childbirth workshop to learn practical and easy to implement tips to make your birth smoother and more enjoyable. So see you soon there. Bye bye.